Are you pregnant and interested in an epidural for pain relief? Let's break down what is an epidural and what are some tips from a labor and delivery nurse. I'm Roxanne, I'm a labor and delivery nurse and student midwife, and let's discuss what an epidural is. So an epidural is called neuraxial regional anesthesia. So basically this means that it's numbing you from like about the belly button down, and it's being placed into the back area in front of the spinal cord. They do use a needle to administer and place the epidural, but the needle does not stay in. A lot of people have that misconception that when they get an epidural, there is going to be a needle in their back the entire time. But after the epidural is placed, there is a thin catheter that's being placed into that epidural space that's actually in front of the spinal cord. And that is what's administering or giving that pain relief, numbing you from about the belly button down. When you're getting an epidural, they are placing it in front of the spinal cord, not into the spinal fluid. When you insert the medication into the spinal fluid, that is a spinal anesthesia that has quick relief because it's being administered to that spinal fluid and it's causing instant numbness. Whereas an epidural is in the potential space where there are nerve endings in front of that spinal cord, and the nerve endings are slowly absorbing the medicine and causing that numbness. So with an epidural, you do not get instant relief. It does take about 15 to 30 minutes for you to have that maximum numbness. During the placement of an epidural, there are positions that you can sit in and kind of adjust into that makes it easier for the anesthesiologist to be able to place it. So this is your spinal cord, and on the back of your spine, you have these like little vertebral notches. And if you bend over in that lower portion of your spine, that is, you can see creating more space for that provider to be able to get to that epidural space. You can see like the bones are kind of moving. But when you're moving just the top, you can see it's not really moving the bottom portion of the spine. So when you get into the position to receive your epidural, you're going to be sitting on the side of the bed, feet dangling off, and then hopefully have a pillow. And that's where you're going to curl around the pillow. And again, we're not really wanting all of the rounding to be in this upper back. We want you to open in this lower back. And this is again, because if we're only rounding in the top of our spine here, this is not opening the space that they actually need to get to, which is at the bottom. So if this is only happening, nothing is opening up here to allow them to get to that epidural space easier. But if we're rounding in the lower spine, so pushing this portion of your back out, it's not going to be like, oh my gosh, you're like a full like rainbow almost, because you're not going to be able to have that much movement, but you need to be able to have some movement in this lower spine because that is what's actually opening up that lower portion of the spine to create more space for them to get into that epidural space easier. So if you know you're wanting an epidural during pregnancy, or at least open to getting an epidural, it can be beneficial to do some spinal mobility movements throughout pregnancy so that you're able to access that lower portion of the spine when they need you to open it up. So doing rock backs on a birthing ball can be really beneficial as one option. An epidural is a really great tool that we can utilize during our labor to help decrease the amount of pain that we're experiencing, especially if maybe you're having a longer labor or if you just choose to have an epidural. 70% of people choose to have an epidural during their birth, and this is a really great option available to us that can help decrease the amount of pain and make birth a little bit more comfortable for us. By understanding what is happening during the placement and why the epidural is working can be helpful, as well as doing some spinal mobility before the placement so that it makes it easier and quicker for you for that placement to get pain relief faster. If you're looking for more information about an epidural, please comment below and we'll be sure to get to your questions. If you enjoy this video, please like and subscribe to our channel so you can be notified whenever we release new videos. We release 2 educational videos a week and 1 workout video.